My name is Sandro Galea. I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome to today's Public Health Conversation. These conversations are meant as spaces where we come together to discuss the ideas that shape a healthier world. Through a process of speech, debate, and generative exchange of ideas, we aim to sharpen our thinking and our approach to building such a world. Guided by our speakers, we work towards a deeper understanding of what matters most to the creation of healthy populations. I want to thank the many who helped make these events possible, in particular our Dean's Office and our communications teams, without whose efforts these conversations would not take place. Today's event is part of our fall series called A Vote for Health, where we have been welcoming speakers who will guide our thoughts on issues of consequence for health and the upcoming US federal election. Today, we are going to discuss how the 2024 election intersects with LGBTQ health. We're going to look at social and political forces that are shaping LGBTQ plus health in this moment and reflect on how public health can continue to support the health and dignity of this population and all populations. I look forward to learning from our speakers as we discuss this topic. I'm very pleased to turn over today's event to our moderator. Orion Rumler is a reporter at the 19th, focusing on state politics, breaking news, and the underreported ways that trans and queer people are marginalized. He previously covered breaking news for Axios and contributed research to Axios on HBO. Orion, thank you for joining us. Over to you.
Thank you, Dean Galea, for introducing me. I'm so happy to moderate today's discussion. I'll introduce today's speakers. First, we'll hear from Jose A. Bauermeister. Dr. Bauermeister is the Albert M. Greenfield Professor of Human Relations at the University of Pennsylvania and the founding faculty director of UPenn's EDIOS LGBTQ initiative. His research integrates perspectives from public health, social science, medicine, and human sexuality to create behavior change interventions that can reduce the health disparities experienced by sexual and gender minority adolescents and young adults. Then we'll turn to Kareth Conran. Dr. Conran is the former Blackford Cooper Distinguished Scholar and Research Director at the Charles R. Williams Institute on Sexual Orientation Law and Public Policy. She's a social and psychiatric epidemiologist whose work focuses on documenting and reducing inequities that impact sexual and gender minority populations. Dr. Conran is also affiliated with the Fenway Institute, the Heller School for Social Policy, and the Department of Maternal and Child Health at the University of North Carolina at Chapel Hill. And then we're going to hear from Sanisha K. Dale and Jasmine McKenzie. Dr. Dale is a tenured associate professor in the Department of Psychology and a licensed clinical psychologist at the University of Miami. She's the founder and director of the Strengthening Health Through Innovation and Engagement Research Program. Dr. Dale's primary research interests are enhancing our understanding of the relationships between resilience, trauma, and health outcomes among individuals with HIV and those placed at risk for HIV, investigating psychosocial and structural factors that relate to HIV health inequities, developing effective prevention, intervention, and implementation strategies to promote resilience and good health outcomes among survivors of trauma and individuals placed at risk for HIV, especially those minoritized due to racism, sexism, heterosexism, and cisgenderism, and who are heavily burdened by the HIV epidemic, and engaging community members and stakeholders in this research. And then Jasmine McKenzie is the founder and executive director of the McKenzie Project, a Black trans-led and Black trans-focused organization based in South Carolina. A Black transgender woman, Ms. McKenzie has been living with HIV for the past 19 years, and 3 years ago, she openly came out to her community, family, and close friends about her HIV status. And then finally, we'll turn to Asa Radix. Dr. Radix is the Executive Vice President of Research and Education at the Callen Lord Community Health Center in New York and Clinical Professor of Medicine, NYU Grossman School of Medicine. Dr. Radix is board certified in internal medicine and infectious disease and completed postgraduate training in public health and epidemiology. Dr. Radix has presented both nationally and internationally on LGBTQ health issues and has assisted in developing guidelines in transgender health from multiple agencies, including the World Health Organization and Pan American Health Organization. We have so many really talented experts today to discuss this issue with us. And as a reminder for our audience, the format today will be a moderated Q&A discussion. When we have about 20 minutes left in the program, we're going to have audience questions. So please submit questions using the Zoom Q&A function in the bottom middle of your screen. So Dr. Bauermeister, I'd love to turn things over to you.
Thank you so much, Ryan. I'm going to go ahead and share my screen. Let's see here. All right, hopefully you're seeing what I'm seeing. Good afternoon, I'm Jose Bauermeister. I use he, him, his pronouns. I decided to talk a little bit about the role that public health plays in thinking about voting behavior, particularly among LGBTQ plus communities. And I come to this work because when I was training in public health as a doctoral student, we were talking a lot about civic engagement and community participation. But the idea of being involved in elections or trying to sway or persuade the electorate into a particular set of beliefs and ideas was often perceived or received with tension, right? Like, is that really the role of public health? And what I'm hoping that I'll share with you in the 10 minutes that I have is to just say that, in fact, voting is important to public health because it's the only way by which we can address the social determinants of health, either through shifting the way that we promote policies, norms, and understandings of how social position or other socially determined circumstances create inequity, and are actually the largest mechanism by which we can ensure that those beliefs get cemented into laws, policies, and help us actually, for example, have the purse strings necessary to have a holistic, comprehensive, and well-running public health system, right? And so I think ultimately, if you take anything from my talk today, is that voting is essential to health equity. And if we don't vote, we will be left behind. I was thrilled when Healthy People 2030 came out to see that under the social determinants of health, voting had been added as a social determinant of health. And unfortunately, when I went into the link 2 weeks ago to put these slides together, the most recent data actually shows a decrease. We seem to be getting worse as it relates to the proportion of voting age citizens who actually vote in the elections. And so I appreciate BU for putting this panel together so we can really kind of highlight the need that all of us should be out spreading the word and voting if we can. So what is the current climate and the literature say about voting behavior and LGBT health? Well, unfortunately, the data is not comprehensive, but the data that we do have does show that sexual and gender minority individuals, particularly trans individuals, face systematic barriers, which are often exacerbated by hostile political environments. And from the limited, oftentimes cross-sectional data that we have, looking at the role of supportive or restrictive policies on the lives of LGBTQ people, there is some evidence to show that folks that live in states that have more supportive LGBT policies, laws, and regulations often report better health outcomes than those who live in more hostile political climates. I think many of us have seen the increased attack on gender-affirming care and rights of trans people over the past 2 to 3 years. But increasingly, we are seeing studies, epidemiologic studies, showing how these restrictions, when they are enacted into policy, are associated with anxiety, depression, and suicide among trans communities. Similar pathways have been seen among cisgender LGBTQ plus populations around marriage equality policies before Oberfeld. I mentioned this, that the data isn't great, and so this is my necessary plug to say it's imperative that we have accurate data collection as it relates to sex, gender, and sexual orientation at the federal level. It is very difficult without it to be counted in the census and through other federal systems. And from an epidemiologic standpoint, it makes it even harder for us to ensure that the data we do collect from sexual and gender minorities actually aligns with probabilistic samples that we do inferences from. And so voting matters because depending on the administration at play or the norms that we propose as citizens of this country, public opinion as to whether or not we should be including sexual orientation, gender, and sex into our federal documentation can be a priority, or it can actually be removed from a policy priority list. Now, as it relates to the sociology of the voters in the US, again, the data isn't very thorough, oftentimes because even when there is nationally representative panel data of voters in the US, they don't collect sex, gender, and sexual orientation correctly. And so, so take that with a note of caution, but do know that oftentimes the perception is that LGBTQ plus individuals are more likely to endorse liberal candidates and policies than their cisgender and heterosexual peers. Although this really great piece by Jones in Public Opinion Quarterly called attention to intersectionality and the fact that we should not be treated as a monolith community, that in fact there are different policies that may pull and push us in different directions as a result of multiple identities. Voting matters for our judicial and legislative contributions to society. We know that in jurisdictions where we got to appoint our judges and other members of the legislative branch, it can really affect what gets to the floor, what gets supported, what gets vetoed. And that can have direct and indirect implications for LGBT rights and access to healthcare, as you'll hear from some of our panelists today. It's super important to recognize that to the extent that we do not call attention to anti-LGBTQ plus laws and contest court rulings, it'll be really hard to move the needle in a way that actually brings everybody forward within our community. And I think the most recent court decisions around the care and the rights of trans youth, for instance, in schools is a great example of the challenges that are still ahead of us. So if I had to give you a wish list of things that hopefully many of us on this call will take on, not just in terms of voting in November, but moving the field forward, there's definitely more need to be looking long-term at the impacts of different political environments on LGBTQ plus populations, and really trying to understand the theories that might help us understand how these social determinants of health come to happen in our lives, and more importantly, making these data as they emerge publicly available for transparency and rigor. Finally, I would not be a good public health scientist if I didn't talk about interventions. And so from my standpoint, the best upstream interventions start with community organizing and policy reform beyond just individual level behavior. And so we are in a critical moment to be thinking about voting in the LGBT community and for the LGBT community, as you can see here from a really terrifying infographic that was put together by CNN using ACLU data. You can see that in every single area that public health is involved, we have seen quite an increase in anti-LGBTQ bills in each legislative session in the US. And so we have to be thinking about civic engagement as public health, and voting being an indicator of how we do that. And so with that, I will yield back the floor, but just remind you to go onto vote.gov and to make sure that your registration is updated, or if not, register to vote. Thank you.
Thank you so much, Dr. Bauermeister. Up next, we have Dr. Conran.
Thank you so much, Ryan. My name is Kara. I use she and her pronouns, and I wanted to spend some time today talking about cost of living. Both presidential candidates have referenced the price of a loaf of bread and cost of living concerns for the American people. And I wanted to remind folks in policy and programmatic spaces and research that LGBTQ people in particular are impacted by cost of living. I want to share some data with you from a survey that we did in LA County using a large representative sample. The reason I'm presenting county-specific data instead of national data is in part related to Jose's comments about data gaps. So most of what I'll show you is similar to what we know nationally, but some of the data that we have goes a little bit deeper because of some great questions that the LA County Health Department thought to ask on their survey. So without further ado, there are over 13.9 million LGBTQ adults in the United States. Many live in urban areas. We see in some national data that poor health and economic well-being are more common for LGBTQ than non-LGBTQ adults. But unfortunately, LGBTQ people are often invisible at state and local levels where a lot of the action intervention happens, which means that their needs may not be considered by state and local agencies. So in LA County, the county invested in an address-based sample of over 9,000 adults. And LGBTQ people made up over 1,000 of those adults with some strategic oversampling. And we were able to do a callback of those 1,000 folks, and we had just over 500 of them participate in what we call the LELAC survey, which allowed us to ask some specific questions that were unique to LGBTQ people, including some open-ended questions, so we could gather some qualitative data. This being said, most of what I'm going to show you is from the full sample of 1,000. So the sample, I'm going to show you a lot of numbers sort of quickly, was diverse in terms of age. 43% of the sample was under the age of 35. In the US as a whole, we see about half of US LGBT adults are under the age of 35. Our sample was diverse in terms of sexual orientation and gender identity. Here we see slightly more people were cisgender men. In general, we see a little bit less than that in the US. The sample was 14% transgender and non-binary folks. That's pretty common is what we see in the US. And then in terms of race ethnicity, much like the United States, we have a racially, ethnically diverse group of people. So on our qualitative portion of our LELAC survey, we asked folks, what are your biggest sources of worry? And what we found is that 2/3 of LGBTQ adults express concerns about economic stability. We see this in quotes like, my biggest source of worry is not being able to take care of myself and my household. Another person said, unemployment and losing my home and being homeless were his greatest sources of worry. So in this data set and what we see nationally is that more LGBTQ than non-LGBTQ adults are unemployed. But what I do want to note is that 84% of LGBTQ adults are in the workforce in this particular data set, and that's common in the US too. Most LGBTQ adults in the workforce are working. Unfortunately, 1 out of 3 LGBTQ adults in the county were living below 200% of the federal poverty level. The poverty, and if you want to know what that means, there's a little bit of data up on the slide in terms of income levels. We see that there are disproportionalities in terms of who's low income. More trans and non-binary people are low income, more LGBT people of color are low income. We know that LGBTQ adults in LA County and in the US are more likely to rent, particularly people who are living in low-income households at below 200% of the federal poverty level. LGBTQ adults are more likely to be severely burdened by housing costs than non-LGBTQ adults. That means spending more than 50% of your household income on housing. And that is particularly true for people who are living in low-income households. Here, folks were asked to describe their household financial situation. And these are LGBTQ adults, and you can see that more than 1 out of 5 people living in low-income households reports that they don't have enough money to meet their basic expenses, and a full 45% are just meeting basic expenses. So when folks were asked if they've had difficulty paying for housing in the past 2 years, LGBTQ people, not surprisingly, more of them were likely to say that they had difficulty. And this was somewhat more true for LGBT people of color, and as you would expect, much more true for people living below 200% of the federal poverty level. LGBTQ adults were also more than twice as likely, nearly twice as likely, to have been unhoused in the past 5 years. So we see in many data sets that LGBTQ people are more likely to be homeless than non-LGBTQ people. This is related to the cost of living and poverty. We also see that more LGBTQ people of color, and as you would expect, people living in low-income households to report being unhoused. So in terms of the loaf of bread, more LGBTQ people in this data set and many others are more likely to report food insecurity within the prior 2 months than non-LGBTQ people. And this is particularly true for LGBTQ people of color and people living in low-income households. So what does this mean in terms of pandemics, COVID-19 pandemic? What does this mean in terms of wildfires, hurricanes, and floods? It means that we have a group of people who are more likely to be vulnerable to losing home, to food insecurity because they have inadequate income. And also we're seeing in other data, inadequate assets and wealth accumulation. And so the overall theme of my slides is to make sure that we are thinking about economic well-being as a key driver of health for LGBTQ people, and thinking about including economic priorities in the public policy agenda, and that many of both candidates are talking about cost of living. I think each has different sets of proposals related to how they would address this. One of the major things for LGBTQ people that may be somewhat different from non-LGBTQ people is that we have to make sure that barriers to employment, housing, and education related to SOGI, sexual orientation, and gender identity are enforced in our existing non-discrimination protections. It would also be fabulous to pass the Equality Act to make sure that these rights are enshrined for all people in all domains of well-being across all states and not subject to interpretation. We need to really think about increasing the minimum wage to a level that would allow workers to cover their housing costs, accrue savings for emergencies, and manage fluctuations in living expenses like rent increases, gas and food prices. We need to, of course, work on an LGBT agenda includes working for rent control, stabilizing rents, and building more affordable housing. We need to make sure that LGBT people are familiar with public benefits and resources and can access them without harassment. And so this means making sure that there are outreach and efforts targeting LGBTQ people, and making sure that when people come in to receive benefits and enroll, that they are met with a warm reception, making sure that barriers related to identity documents are also removed for transgender people in terms of enrolling in public benefits. And then we have to think about how can we reduce through policy intervention the costs associated with education, student loans, childcare, and family formation. More than half of LGBTQ people in this country are under the age of 35. They are struggling with the housing market. They are struggling to, manage federal loans. Many of them want to have families, but the cost of family formation, particularly if you're an LGBTQ person, is high. So these are the types of things I think we should be thinking about as in public health, and that need to be integrated into policy platforms in order to make sure that LGBTQ people benefit from interventions to improve economic well-being and ultimately health. Of course, we need to expand data collection. And finally, I want to thank my collaborators on this project. Research, of course, is a team sport, and turn the microphone back over to Orion with my thank you.
Thank you so much, Dr. Conran. And now we'll turn it over to Dr. Dale and Ms. McKenzie.
Good afternoon, everyone, and thank you for having us. My name is Sinisha Dale, and I'm an associate professor here at the University of Miami in psychology, primarily and secondarily in public health, and I direct the SHINE research program, as well as had different community engaged efforts through our Center for HIV and Research and Mental Health. And I am beyond grateful today to be co-presenting here with Jasmine McKenzie. She's the founder and executive director of the McKenzie Project, and also the founder and CEO for House of the South, founder for Color and Raw, and founder and CEO for TransGame. She is beyond impactful in the local Miami community and also beyond domestically in the work that she's doing. So I'm going to move along quickly because I think one of my most imperatives that I hold in terms of the work that I do, research, community, otherwise, is how to center and elevate the voices of people with lived expertise and those with boots on the ground who are doing the work every day to resist and uplift individuals. And so I'll be just sharing a few quotes actually from qualitative work we've done among trans women and community stakeholders. And then I'm going to pass the mic over to Jasmine McKenzie to reflect on the impact of elections, the policies, and the work that they're doing at the McKenzie Project to dismantle what the communities are facing. One thing that was said, I believe, by the first speaker that I like to echo here is the importance of intersectionality as we think about the LGBTQ community and what changes need to be made systemically, structurally, and across the U.S. This quotes that you're seeing here, I'll read a couple of them, but one said, and as you can see lately, what's been happening in the news in the last 5 years, Black transgender women in particular, have been facing violence at larger rate than any other group, and I think that needs to be addressed. Another said, because there are areas where there are no doctors that are willing to touch a trans person in Florida. It's really hard for someone in our community to go to a provider for treatment and be misgendered. Another person said, two other trans women said, we're just trying to fit in this society. We know that we're being excruciatingly marginalized by the society. The stakeholders that we spoke to, many who, again, come from an angle of lived expertise, spoke about doing everything they can with limited capacity. We do everything and anything possible to make it easier for a trans person to live and thrive. They also spoke about the multiple lens and intervention that's needed to really address the well-being of trans individuals holistically. So if a barrier is transportation or a lack of income or homelessness or food, trying our best to address those behaviors and those barriers first. The other part I want to echo here before Jasmine begins is the importance of collective action. So when we vote not just for ourselves, but for the entire community. And that's something important to keep in mind. And this stakeholder said, it's about you standing up for your rights. That's why for me, I want to be an inspiration to the community, be their voice, and I want our voices to be heard. Come out and share your experiences and be the advocate for your own community. And now I'd like to pass it over to Jasmine McKenzie. And on the screen here, you'll see some images of some reflection of the work they're doing.
Good afternoon, everyone. Earlier it was mentioned that I'm from South Carolina. I am from Miami, Florida. And I wanted to dig into because I have a three-part question where the first one says the impact of elections, and then the second one said policies needed to dismantle systemic and international isms and the work that is being done by the McKenzie Project. So I'm gonna touch bases on policies needed to dismantle systemic and intersectional isms, which may take up my whole time because I think that is the most important part of the conversation that needs to be heard. It needs to be said in order for me as a Black trans woman to get my voice to be heard, to make change happen. So the first thing I would definitely say is anti-discrimination protections by implementing affirmative action and expanding legal protection for those who are breathing while Black and trans. The second thing I would definitely say is health and mental health access, universal health care to provide gender affirming care, increase funding for mental health programs, and decriminalize sex work and provide health access. Oftentimes there's so much stigma around it where people don't want to put the dollars behind it to make that change. The third thing I would definitely say is economic justice and living wages. By implementing living wages and offering economic empowerment programs. And that's one of the things that we do at the McKenzie Project. We focus on creative arts and entrepreneurship studies because we know that if someone who is homeless, they don't have no means of income, we would teach them how to build a business from scratch, teach them how to get an LLC, how to do things to get themselves self-sufficient. So I think if we have more programs around that, we can definitely help so many people of trans experience to become self-sufficient. My fourth thing will be housing justice by enforcing affordable, supportive housing mandates, strengthening and creating tenant protections. And that is something that I have been able to create here in South Florida, the first ever all Black trans tenant union, where we get to come together as a collective to learn about our rights, to go speak to other people who have dealt with being evicted from discrimination, high rent costs, and things of that nature. The fifth thing I would definitely say is criminal justice and police reform. For one, educating those who are Black and trans about what it looks like and what it is to be someone who is Black and trans that is a part of the prison industrial complex, and focusing on dismantling the school to prison pipeline. Oftentimes, we have so many people of trans experience who is already in that pool of issues. And sometimes they don't even know what it is. They don't even know what it looks like, because that's not something that we really get a chance to talk about. And I think it's very important to establish community-led alternatives to policies. And we need to end cash bail systems that disproportionately incarcerate poor Black and brown people of TGNC experience. And the number 6 will be education equity, mandating exclusive curriculum, funding scholarships and education programs with less barriers to access these fundings. When we have these little small micro grants and funding for stuff like this, there's always too many barriers for people to access to get the things that they're needed, which makes it really, really hard where they're not able to actually apply for it. The 7th thing will be environmental and climate justice, policies that address the disproportionate impact of climate change in low-income communities, and fund community-based climate programs that is led by folks who are breathing while Black and trans. And that's another thing that we don't get to talk about within the spectrum of working with people who are Black and trans, because oftentimes people don't even realize that climate justice plays a major part in almost everything we do in our daily lives. And people don't even know that because we don't get a chance to talk about it, or we don't get the privilege to be in spaces with those who are privileged to talk about these things. And this is why, again, I created an initiative called HRT, which is the Hurricane Response Team, where I get to educate and train and teach those in my community about climate change, how it is a part of harm reduction that affects our community on so many levels that people sometimes didn't even realize that this is what was happening. And the 8th thing I would say is comprehensive social support by developing intersectional social safety networks that provide non-stigmatizing access to food, healthcare, housing, financial aid for folks who are triple marginalized. And when I say triple marginalized, I often feel like we can be triple marginalized, triple, if you get what I mean. Also, I think people need to trust and fund community-led organizations and stop giving Black trans-led organizations the lowest amount of funding and expect for us to make a miracle happen with the lowest amount. And I know that for a fact because I'm someone who is continuously, I face that here in South Florida, where we're applying for grants and they're giving us the bottom of the barrel, but we're the ones doing the most work, and we're the ones that's navigating around the systems of oppression to make things shake. And they just like, well, how do you do it? I'm like, well, if we have more money, we can create this model to give this model to other people to make that change here in South Florida. But because we don't. And my 9th thing would be labor rights and workers' protection. Speak up and implement intentional workers' protection, including fair wages, standards of benefits and safety, addressing workplaces of harassment through comprehensive training and accountability measures. And oftentimes, for me as a person who is an executive director, created multiple organizations. I don't have a high school diploma. I don't have a degree. So many people denied me, so many jobs denied me because I didn't have a degree and I didn't have a high school diploma. But I'm a living testimony to show people that sometimes it's not always about the degree, because guess what? A lot of people that I work with now have degrees and they don't even know half of the stuff that I know because it comes from my lived experience. And when you're working with community, it's a difference when you have somebody who is who have a degree with certain things versus someone who have the lived experience. I am someone who have engaged in survival sex work. I am someone who have faced homelessness. I am someone who is triple marginalized. I am someone that has been harassed. I am someone that has been robbed. I am someone who has been beaten with a gun. I am someone that had to sleep under the park. So a lot of things that goes on with what's going on in our state, it's a part of my lived experience. And that's what makes me such a powerful voice for those unheard voices, because I'm able to speak up and speak out about it. And it makes sense. And my last thing I'm going to say before I leave out is political and civic participation. I really don't get into politics because of the organization, but I will say this: we must ensure that marginalized people of transgender experience has the proper documents and education to understand why it's important to vote with safety practice. And when I'm talking about safety practice, I'm talking about safety practice when we have Black trans people, Black trans men who don't have the privilege of being out, who don't have the passing privilege to go to certain places and not have to worry about, am I going to come home safe? Are these people going to attack me? Are these people going to harass me? And then we can't really call the police because the first thing they're going to say is, oh, you trans, you this, and you try to fool them. It's just so much stigma behind it. So let's talk about how we can create safety measures. Let's put some money into organizations, say, hey, here's $10,000. We need you to get a bus and gather up people who is, in certain areas, and you take them to the voting polls. You take them to go vote. You make sure that they have food, they have drinks, because that's what, that may be their only meal that day. So that's that. And my last one for this is local politicians need to do more work in our community. If they're going to fight for our community and say that to support Black trans lives, they need to be in these same exact spaces with Black trans people marching in the front line, giving us funding, helping us and educating our community. So yeah, that's my piece.
Thank you so much, Ms. McKinsey and Dr. Dale. Really appreciate it. And finally, we have Dr. Radix to close us out with our speaker presentations.
Okay, hopefully you see this. I just want to say that was amazing. Thank you, Jasmine. And of course, all the other speakers. So, I'm just thrilled to be here to talk a little bit about, well, a reflection of the work that I do, I should say that. I'm going to be talking about the challenges related to providing adequate evidence-based care for trans and gender diverse folk, and also the importance of government and policy to support creation of these inclusive and specific clinical practice guidelines. And obviously, this is so important to advance health equity. Well, it's election year, and I just want to start by acknowledging that trans health has been a divisive issue over the last year. I learned from a presidential candidate recently that children are undergoing operations at school. I mean, we know they're not. This is not the truth, but the reality is that discussions of trans people and trans health are now on center stage. And how can we leverage this opportunity to get the real word out? So, just for some background, in the US, the newest estimates are that about 1.3 million adults are estimated to be trans. We also know that transgender adults, actually all trans people, report significantly higher rates of poor mental health, including high levels of psychological distress, suicidality, and self-injury, higher odds of poor general health, chronic conditions, and disability. You've heard this before, compared to cisgender individuals, and also experience discrimination from clinicians, leading to healthcare avoidance and worse health outcomes, and barriers to accessing gender-affirming care due to, structural stigma in health systems, which includes a lack of clinical practice guidelines. We know that upwards of 60% of trans people in the United States have accessed gender-affirming care to improve their health outcomes and reduce gender dysphoria. And I think the next thing is, there are important questions regarding the direct effects of these interventions, such as surgery and hormones on physical health, including the impact of hormones on metabolic parameters. You can see here cardiovascular and bone health, cancer and fertility, and looking ahead how these results of research can translate to policy changes. For example, what are the recommendations for breast cancer screening for someone who's assigned female at birth, but who's had bilateral mastectomy and is on testosterone? or, you know, what sex marker do we use when we're looking at sex-based clinical algorithms? And I just wanted to bring it down to the personal because, you know, I'm a clinician, but, you know, if you have a woman who's, you know, of trans experience, who's 66, who's had, you know, top surgery, she's had breast implants, she's had bottom surgery, you know, a vaginoplasty, who's an ex-smoker, you know, this is relevant because we know, you know, 1 in 10 transgender women have had breast implants, and a little over 10% have had a bottom surgery or a vaginoplasty. You know, what are her preventive care needs? What did the guidelines say? I mean, we have guidelines that say for cis women, you need to do breast screening at a certain age. You need to do cervical screening at a certain age. For cisgender men, you have to do prostate cancer screening. I think we all agree that this person is going to need colon cancer screening, but there's so much more. Does she need screening of her vagina? Does she need breast screening? You know, how are we going to assess cardiovascular risk? And, you know, when I talk about clinical practice guidelines, I'm just using a NASM definition that we're looking for recommendations that optimize patient care that are informed by, you know, a systematic review of the evidence. And an assessment of benefit and harms. You know, besides benefit and harms, we also need to be looking at acceptability, values and preferences, feasibility, you know, resources and costs of these. And I'll say we have thousands of guidelines that cover a multitude of conditions that help us, you know, I'm also a clinician, that help us make evidence-based decisions, standardize care and ensure quality. And again, improve patient outcomes. But, you know, when we look at the guidelines, this is from the USPSTF, which is, you know, an independent entity, but still influenced by government, right? That the guidelines are gendered. So we have guidelines for men and abdominal aortic aneurysm screening, for women and mammography, for women and cervical cancer. And even when it doesn't reference, you know, sex or gender, you know, you need to know that in order to apply some of the algorithms. So this is a cardiovascular risk that, again, is based on whether, you know, in the box you checked male or female, and it can significantly change your cardiovascular risk. So if you're male, you know, it's higher. But what do we even mean by that when we put male and female in? And, you know, I wanted to bring this up because, you know, again, like trans issues are on center stage right now. We need to also be thinking, you know, when someone's on hormones, we know there are impacts on hematologic as well as metabolic factors, you know, but not all in the same direction. Sometimes if you start on hormones, your numbers, you know, if you start on estrogen, your numbers are more in line with cis women, but sometimes they're not. And how do we know that? You know, currently we rely on case reports, you know, case reports of folks who've had bottom surgery who develop cancer, or who've had top surgery who develop cancer, or who've developed an unusual infection that we don't expect to see. But, you know, regardless, like, we need to create these guidelines. And what I will say is that, you know, the question is, like, what influences clinical practice guidelines? And I would say public policy, government, political will, all of these things impact clinical practice guidelines. So, you know, regulation, legal protections, you know, what Medicare and Medicaid cover, what the funding is, what is the funding for research, what are the research priorities that exist. So, you know, as far as my recommendations for whoever gets into the top seat would be, we need to increase trans-specific research. You've heard that before. Allocate more funding for studies on trans health, especially in areas where data are limited, such as hormone therapy, mental health, long-term outcomes. Focus on high-impact areas, primary care, chronic conditions, reproductive and mental health. Increase those longitudinal studies where we can actually find out about outcomes, right? And of course, inclusion of trans people in all types of research. And you've heard this before, standardized data collection, you know, that's inclusive with standardized methods to accurately capture gender identity and medical history. And also we need to disaggregate data. You've heard a number of people say that, health issues for, specific populations such as, Black trans women can look very, very different. And we can't just kind of bunch everyone into one box and that's it. We need more information on non-binary folk. I had another bullet here, but it's really about, again, the political will and ensuring that this type of research gets done to improve health equity for all of the communities we serve. Thank you.
Thank you so much, Dr. Radix, and thank you everyone for sharing your expertise, your personal experiences, and just all of your research with us. And so we're going to move on to our moderated discussion. And for folks tuning in, if you're interested in asking a question, please submit one in the Zoom Q&A function at the bottom of the screen. And if all of our speakers joining us for the discussion could turn your cameras on and your microphones on, that'd be great. And whenever I ask an open-ended question, if you want to jump in, please feel free. No need to raise your hand, although you can if you want. But fine to just jump in if the spirit moves you. So, Ms. McKenzie, I really appreciate it, as did a lot of other folks, all the personal experiences that you shared with us and all the different organizations that you're working on in South Florida that you founded. One of the ones that stuck out to me was climate justice. You mentioned that, we don't get a chance to talk about it. We meaning, I assume, like trans people and Black trans women. And with the hurricane response team in South Florida, you're working with them. So are LGBTQ and trans people, as you're seeing it in Florida, are LGBTQ and trans people more susceptible to these disasters? Is the concern that they're more likely to face long-term health and economic ruin afterwards? I'd love to hear more about that from you.
So right now, because of the hurricane that happened 3 years ago, that was the reason why I started the hurricane response team, because during the time of the hurricane, we had no place for trans people and LGBTQ people to go to. Everybody was like, "Oh, we don't have room for this, we don't have room for that." And I'm just like, well, what the hell are we gonna do? So it was nothing at the time that I could do. So I partnered with the organization called the Smile Trust. The Smile Trust gave me $1,000 to create a hub. I promise y'all not. That $1,000 helped. That $1,000 that I used helped over 500 plus trans people in the entire state of Florida. What I did with that money, I took that money and I stretched that money. And once I saw the need for it, I made the HRT Hub a new program of the McKinsey Project. Now it has grown where we're getting funding, where we now have at our new drop-in space, we have flashlights, we have batteries, we have blankets, we have generators, we have gas bottles, we have candles, we have all type of things that is needed for people in the entire state of Florida to prepare for a hurricane. And one of my trans sisters, who was someone who engaged in survivor sex work, I convinced her to use her sex work money to buy 3 vans. So with her 3 vans now, she will use one of those vans to take all merchandise that we have throughout the entire state of Florida for free at the front doors of trans people to make sure that they have what they need. And it's not just trans people. We talk about trans individuals, non-binary people, gender non-conforming people, queer people, lesbians, gays, bisexual, anyone who is in the spectrum of LGBTQ who needs that help, we will deliver it to their front door. And the second best thing is we was able to get a grant to support trans people where we are able to use our drop-in space as a hurricane shelter during climate disaster. So now we're able to house 32 people at our drop-in center in Margate, Florida during hurricane season or any natural disaster that may occur. So right now, that is what I have been able to do. And when I apply for these grants, these people say, well, I didn't know that was going on in Florida with trans people. I'm like, yeah, when trans people go to shelters, there's a problem. We don't have not one housing program in South Florida for trans people. And that's why I created House of the South. We now have two locations for House of the South. We're now able to house 8 people of trans experience, but that's not enough. When you're getting over 400 something calls per week compared to 8, so it's like it's very hard to kind of manage who we should give the housing priority to and who needs it more than the next person. And even still, we're still not getting enough funding for housing because for some odd reason, they feel like housing is still not a need. And it's so evident and it's so visible to see that it's definitely a need.
Thank you so much, Ms. McKenzie, for discussing your work and just the need that y'all are facing. And another question I have for Dr. Conran, you said that more economic priorities concerning LGBTQ people need to be included in the public policy agenda. Have you seen either candidate in the 2024 presidential race do that, to explicitly include LGBTQ people, whether it's the barriers to employment, housing, or education that you discussed, increasing the minimum wage? And I'm sure other speakers have thoughts on that as well if they want to chime in.
I have heard one of the candidates talk about support for home buying and the use of tax credits to make it easier for people who have children. I think these are terrific ideas. I think that the current president has tried to alleviate student loan debt. That would have disproportionate benefit for LGBTQ people. Some places where I would like there to be more action. I think tax credits are great if you have the money to lay out and get it back, but they don't help people who have the least money. And for that reason, I think there need to be zero interest loans or grants to allow people to have the money that they need to make a down payment on an apartment where you need several $1,000s, or for a car purchase so you can get to a job. Or even something bigger like, a first-time home, because lots of people don't have that money to lay out. So I would like to see there to be an expansion in the dialogue of both candidates for the lowest income people and moving beyond the middle class.
Thank you so much, Dr. Conran. And I had another question for Dr. Bauermeister. You showed us that ACLU data about how many areas of life and public health have been impacted by anti-LGBTQ state bills. When we're talking about the 2024 election, Trump has disavowed Project 2025, but the federal policies pitched for a future Republican president by the Heritage Foundation in Project 2025 would take these state policies to the extreme. Have you done any examination of these policies to think about how these policies impact the health of LGBTQ people?
So I haven't done them myself. I will say that when we're thinking about voting, we are often pointed to think about the presidential election, which is extremely important. But understanding that you're also voting for your local community officials, for your state representatives, for your senators, governors, depending on where you live, is also super important both at the state level and the federal level, because without a pathway forward for legislation to be signed at the White House, no action can happen, right? So I think the reliance on executive orders, for instance, has come under a lot of contention across multiple administrations because it doesn't really move the needle without it actually being cemented into law. And so what I urge everyone to do is to go look at Project 2025 and spend 15-30 minutes of between now and election day, it's 49 days, and just call one of your local state or city representatives and say, can you help me understand where you stand on this? And I think some of the comments that Dr. Conran made also are prime for that, right? So the presidency is important, but there are 2 other branches of power in this country, and we have to make sure that they're all equally resourced to move agendas forward.
Thank you so much, Dr. Bauermeister. And Dr. Radix, when you were discussing the clinical practice guidelines, especially for trans people, Could you talk more about how and whether LGBTQ people are at a greater risk for things like cardiovascular issues or cervical cancer? And why is trans-specific research so important there? Is it because trans people are just being considered or properly gendered within the research that makes the data strange?
Okay, so I mean, those are really terrific questions. I mean, you know, it's very hard sometimes to get at the data because there's so many confounders, right? I mean, we're talking about populations that tend to smoke more, also tend to get less exercise because you're being harassed in the street and excluded from sports. You know, you're facing food insecurity. I mean, all the social determinants of health, right? I mean, all of these things can impact outcomes like cardiovascular risk. But on top of that, we don't have good measures. Okay, we don't have good predictors of risk, like who should get started on a statin, who should, you know, all of those things we don't know because the guidelines don't exist yet. You know, we kind of guess. You know, I'll say what we do is we run estimates for cis men, for cis women, and then just figure it's going to be somewhere in between the two. But that's not a great way to do clinical practice, right? Best guess.
Thank you so much. And I appreciate the audience Q&As. We're going to get to those very soon. So if anyone in the audience has a question, there's still time to put one in. And Dr. Radix, I had another question. When you referenced at the top of your presentation that former President Donald Trump had repeatedly made baseless claims that American schools are clandestinely performing gender-affirming surgeries on children, which is not possible. I had a question for you. I mean, obviously this is such a blatant lie that it can seem ridiculous, but are there ways that there's something so outlandish, like concrete ways that it negatively impacts trans people's health? Does it put them at a greater risk of violence? And if any other speakers have thoughts, glad to hear that too.
I mean, absolutely. You know, this isn't the only thing that's being said. All of it drives legislation. I mean, we're at a point where in states, I mean, this is absolutely horrifying, but in states, they've actually stopped people being able to change the gender marker on their driver's licenses. This happened in Florida. You know, states are preventing people from having X gender markers. You know, I do work with a conference in Florida where we've been told that we're not allowed to train providers. You know, it's a trans health conference. We're not allowed to train providers in anything that goes against state law. You know, when you threaten someone with a felony conviction for having a gender marker that actually reflects who they are, it impacts so much about your life. You know, I can see people not voting because they're afraid, because they have, you know, they have a gender marker that the state feels is illegal. So yes, I mean, every time something like this happens, it drives legislation in a certain way to shut down care. Care was shut down because people were mistaken in the fact that children were getting sterilized or having surgeries. It does not happen. You know, like I'm a physician. I can tell who does gender affirming care. This does not happen.
Thank you so much, Dr. Radix. And I see Ms. McKenzie, your hand up.
Can you all hear me? Oh Lord, I do. So
Yes.
I wanted to piggyback off what Dr. Radix said about the gender marker. So yes, in the state of Florida, they have mandated that whole situation, but we have figured out a way to beat that system and work around it. So what we do and we tell all people is get the passport, and on your passport, you're able to change your gender marker. So once you have your gender marker changed on your passport, you can take that passport to any driver license place and say, hey, I lost my ID, I lost my driver license, here's the passport in return, and they're gonna go by what's on that passport. So that's how we have been able to beat the system and work around that and get so many people still connected with getting their gender markers. So that is a practice that and that's a model that anybody on this call can now do with clients. And because of that, we have a passport study where we actually pay for individuals' passports, do their pictures and everything, and it's been working. It's been working pretty well. We just hope that they don't come and try to stop that on the passports.
Thank you so much, Ms. McKenzie. And I think we'll head over to questions from the audience because we've got a good number of them. And the first one that we got in was for Dr. Bauermeister, and this one's anonymous. It says, given anti-LGBTQ efforts, there may be concerns about reporting sexual orientation and gender status if this could be used for discriminatory purposes in the future. Though not voting related, in Tennessee, the state requested and received identifying information about folks receiving transgender care at Vanderbilt University Medical Center. In this situation, people thought their info would be private. So my question is, how do we engage people in sharing personal information in this political climate?
It's a wonderful question, and I'm not sure that I have an answer, and I look forward to my panelists helping me out here, but I will say a few things. One is what happened in the state of Tennessee is unacceptable, goes against public health and medical advice. I think actually is a violation of HIPAA, but I'm not an attorney. But to me, it basically creates mistrust in our healthcare system. If we're telling people that this is where you can come be safe, be seen, and leave feeling better, and then without any type of explanation except for political pressure, that in my opinion was unfounded, medical records, medical charts are released to third parties for fairly unclear reasons. And so I think it's important to acknowledge and address these fears that folks have, not just in Tennessee, but I think around the country. I think it's important to, again, call state and federal legislatures and ask for a call to action, either to improve the wording of HIPAA and or extend the protections for LGBTQ plus people, and frankly, anybody else who doesn't want their information to be easily disclosed for political reasons. And finally, I think this is where we all play a part. We all will have a situation where either we or somebody that we love will need to access care. And if they feel that they cannot go into a healthcare institution to get that care, we have a much larger public health crisis in our hands. And so talking to our community representatives, our state representatives, our federal representatives, that our health matters to us, and that includes protecting our rights and our medical charts, is a very tenable thing. I think oftentimes what I hear from folks say is like, well, I'm not really going to be able to move the needle. I'm like, no, you may not, but if we had more people supporting Ms. McKenzie, for instance, I bet you anything that things would actually change. And so community organizing doesn't mean that you have to lead. Community organizing means that you understand the needs of your community and you're willing to play a part into it. And so whether it be through voting or through outside of the 4-year cycles, calling and having your voice heard by the people who are supposed to represent you.
Thank you so much, Dr. Bauermeister. Another question we had from Faith Daniel is for Dr. Radix. The question is, what are your thoughts on telemedicine helping to assist with accessibility to care for LGBTQ plus folks?
You know, it is very important. You know, unfortunately, the medical legal side is a little bit up in flux. There are many providers who used to do this care, you know, across state lines, Florida, Texas, and places like that. And now they're prohibited from doing it in many places. So unfortunately, you know, we saw during COVID, you know, an increase in telehealth, provision of trans health through telehealth. And now I think a lot of people are just too scared. They're scared of losing their license. They're afraid of being convicted, you know. And there are a lot of people weighing in on the legal side, but that hasn't been sorted yet. So as far as can the care be provided? Yes. Can it be provided well, quality, obviously improve access, all of that, great. But the legal side that impacts clinicians, again, is problematic.
Thank you so much. And actually, we have another question for Dr. Radix from the audience Q&A from Chris Brialt. I think I said your last name right. And this one's for Dr. Radix or whoever may have more information on this. But the question is, if we are partnering with doctors performing gender-affirming care, are there any standards or other to help increase trans people research, i.e. common client questionnaires, best practices for data collection, website, etc.?
I mean, yeah, yes to all of that. And I think other folks on this call can talk to this, standardization measures and research, how to identify trans folk in research using assigned sex of birth and gender identity, as well as, a lot of research that's been done in, centering trans people in research, like ensuring that the team is a trans experience. I'm very lucky. I work with a team, we're almost all folks of trans experience, and the work we do is trans research. It's amazing. We have a research cab that's trans. I mean, it's so important. But I think there are other people here that are able to talk about the measures. And I'm certainly happy to, if you want to email me personally, link you to some really fantastic resources as well.
Thank you, Dr. Radix. And did any other speakers have thoughts about that question?
I put it in the group chat, but I said vocally, I think it's very imperative that when we talk about things of that nature, it's important to reach out to local organizations who are trans-led and that can help you with this. Like for me, prime example, I have people from all over that comes to me and ask me about questions about all types of things, how to start a nonprofit, how do I get funding, how do I get this, how do I get that, and it's been a success story because I have been able to connect people with other people in the area, and they didn't even know, like, oh, I didn't know this organization was here, and I've been in here in this area for so long doing this stuff, I never knew this existed. So I think by connecting with organizations, a lot of organizations have directories of other organizations that do different things and similar things. So it actually puts you in a place to connect on a larger scale, which can be so useful for so many people.
If I was to chime in, I'll add something that I actually heard recently on a research trip to Nigeria. But there was a speaker and she said, in terms of doing the work and real impactful work, folks don't need VIPs. So, oh, that amazing scholar has this amazing idea. But what folks need are value-added people who come to the table to say, what are the needs of your community? What needs to be addressed? How can we be of benefit to what you're doing? So I think that's a piece about the lens through which folks need to ask questions and query is ensuring that it's trans-led and that you're doing it from a value-added approach and not trying to ask and do research for research's sake.
Thank you so much, Dr. Dale.
Ryan, if I could add one more
sure,
comment
please.
in response to the guidance around data collection practices in healthcare settings. Fenway Health, the Fenway Institute, has done a lot of SOGI data collection and using anatomical inventories and really thinking about how to provide competent care to trans folks and other LGBT people. And they've published a lot of their work too. So Chris Grasso and Ken Mayer, Jenny Potter. So these are some names you can look for, and I'm also happy to send links to papers. They've been doing some really good work. There also is an education center at Fenway that has a grant to provide TA to folks trying to better care for LGBTQ people. So that's just another resource I wanted to mention.
Thank you so much, Dr. Conran. And did anyone else have thoughts from our speakers? Okay, the next question we have from the audience is from Orlando Rojas. And the question is, earlier it was said that the LGBTQ plus people are more likely to struggle with housing and economic struggles. Is it known why that is the case? Are there any current initiatives that are trying to address this issue? I love this question. Ms. McKenzie's talked to us about local initiatives to address that. And this question wasn't addressed to anyone in particular. Maybe Dr. Conran, you have thoughts about the whys of housing and economic struggles from your research?
You know, I think about this from a life course perspective. We know that bullying and harassment in schools is still a significant issue for LGBTQ youth, which increases risk of absenteeism and dropout. If you don't, you know, as Ms. McKenzie said, it's much harder in life to navigate if you don't have a high school degree, reduces your risk of, you know, your likelihood of being able to go on to college and your earning potential. So I think violence is a contributor, discrimination, lower levels of family support. And I think in terms of cost, thinking about where people migrate in order to find protection and safety, which tends to be towards urban areas and the coasts that have better LGBTQ policies and environments, are probably some of the contributors to why we see some of these inequities. Now, as far as sort of what's going on at a national level, I think that, you know, we are, I still think there's a gap, an intervention gap on how to make school environments safe. But I do want to just ask my co-panelists if you have thoughts about what's happening that's working. My sense is that we still have gaps in the intervention space. We know what some of the problems are, but so far what the solutions are getting us only part of the way. Like enumerated anti-bullying policies are helpful, having GSAs present are helpful to make schools better, but it's still not enough to reduce the major inequities that we see in bullying and harassment in schools, just as one particular case snapshot.
Did you have thoughts, Dr. Dale, about what you said in the chat about oppression, or Dr. Conran's question?
Yeah, I think Dr. Conran kind of touched on the pieces, and I think that's the other part of thinking about the intersectionality lens. So when we think about, for instance, trans women, Black trans women are disproportionately impacted by violence, right? And we could see it trickle down in terms of other disparities that folks will experience. And oppression is not just a word, and it starts even prior to birth for folks in terms of their birth and parent and what they may experience, and then what impacts the actual child. And it goes through school. It goes through the care that you receive as a child. It goes all the way through what Jasmine was talking about in terms of the school to prison pipeline, right? And so there are ways in which the LGBT community is oppressed and consistently marginalized, and it requires policies and laws at the national level. And I think that's what Dr. Conran was saying, that there are many initiatives and different approaches that people are taking, but it won't completely undo what folks are facing, because it's been so structural and so entrenched that we really need for there to be global, domestic, collective action to say that we are going to intercept and intervene when it comes to laws, when it comes to housing, when it comes to access to food, when it comes to climate change. It's all of it, right?
I also think another important factor of this is when we collect data, there is data being collected in some areas. And I'm going to speak specifically for South Florida, where it's really hard to find data amongst the demographics of people that I serve, which is Black, trans man, trans woman, non-binary people, intersex individuals. And it's really hard to find data around almost everything that we need research for. So for myself, I had to be innovative and create a way to create data. So I have been able to create data by partnering with colleges, doing research projects, doing my intake progress when clients come to me, and when I'm working with clients on a global level. So it's like when we have these data collections and we have this data and we look at the numbers of this amount of people and this percentage and that percentage of individuals who don't have this and who don't have that, the question is, why aren't the funding going into these spaces that we say, well, dang, we have 75% of Black trans men who's living with HIV, but we have 20% of Black trans women who is engaged in survival sex work. We have these numbers and we have this information, but what is being really useful to this data? And then when we're doing data collection, we're doing surveys, is here's the $25 gift card. Here's a $10. That's not enough money. If we want real data to change the world for real, we need to have these surveys being able to pay people at least 100 plus. So when these funders and these people saying, here's a research grant for this and here's a research grant for that, they need to up them dollars and make sure that people have something to leave and take away from wasting their time or giving their time to do a survey. Because guess what? If it takes me, and I'm gonna go back 8 years from now when I was someone who engaged in survival sex work, when it took me 30 minutes or 15, 20 minutes to do a survey, baby, I just had a client for 10 minutes and he paid me $2,000. That's my rent right there and there. And guess what? I ain't got to do nothing for the rest of the month because in that 15 minutes time frame, I was able to get $2,000 because I engaged in survival sex work and that was my pay ticket versus me having to do a survey and you want to give me $25 and I don't spent 30, 40 minutes on the survey. What is that going to do? So that's another piece of the puzzle that we have to think about when we're trying to get data and collect data, is making sure that it is intentional, making sure that it is a feasible fee or price that we're actually giving people so we know it's worth their time. Even if you say, hey, y'all, we got to reach, even people can be innovative, it ain't got to be money. You can say, Jasmine, we're doing a survey and we're going to supply you with 100 new lace wigs. Each girl who do a lace or who do a survey, you get to give her a lace wig. Guess what? Them 100 wigs will be going in 10 minutes because guess what? That is a need for the community, especially for the girls who are doing sex work. When we be innovative and find the need for people, even for trans men, I'm pretty sure you say, y'all, we doing a survey for trans men, we can't find no numbers, we can't find nobody. Talk about giving them a haircut voucher or a binder or a voucher at Foot Locker to buy a pair of shoes. I bet you have 100 and some trans men within a day. But see, this is the things we have to think about, how to be innovative and reel people in and get them in to give us the information that we need so we can change the landscape. That's all my piece. I ain't gonna talk y'all ears off today.
Thank you so much. Thank you so much, Ms. McKenzie, for sharing those amazing ideas for how to increase participation in surveys and to just have equitable participation. And Dr. Radix, I saw you in the chat mentioning the importance of value inputs from community. Did you have any more thoughts, or was that it?
No, I was agreeing with Jasmine. I mean, you know, we also in our studies, you know, we ask community members, you know, what do you think a fair rate would be for the survey of, you know, fair stipend, fair compensation, and it's never $20. You know, these are surveys that can take sometimes an hour, and it's not just the time, it's that we're often asking questions that bring up trauma that, you know, I've sat with someone who, you know, was in tears halfway through the survey because of issues of, you know, intimate partner violence. I mean, we don't ask easy questions, and, you know, like letting someone walk away from that is not good, and giving a token that's, I think, is irresponsible to give such a small token is not a good idea. So I was just saying I agree with her.
And if I could jump in here, I think the other part is the ethics of doing the research. So when we hear and we learn and we're aware of what the needs of a participant are, like, how are we responding? because it's also not ethical to say, I'm going to ask these questions and do this work within this community where I know there's already a disproportionate impact on X, Y, and Z. But what are the services? What is the linkage that's happening in the context of the research that you're doing, right? Because I think that's another pull for people. If I'm going to go somewhere, that I'm going to be held, I'm going to be seen, and I'm going to be responded to, and the research is like a part of it, but not all of it, that also makes a difference.
Thank you so much, Dr. Dale. Oh, Dr. Conran, you have more thoughts?
Since we're talking about like community engaged research and being respectful and mindful of our community members, I think that researchers should be budgeting to pay community-based organizations to assist with recruitment and promotion of research opportunities. Researchers can also budget to pay community members to be like survey promoters, even if they're not engaging in the informed consent process and the data collection, but simply to sort of get the word out there with some human subjects training about how to do that in a way that promotes volunteerism. So I think that we can think about ways to expand incentives for individuals, but also to support people in getting involved in research and channeling money through community-based organizations, which have the networks and should be valued for the trust that they have built in the community and the relationships as well.
Sorry, but I have to chime in real quick and say another one and give a shout out to Jasmine on this one. But I think the other part too is to work towards a model of both how RFAs work, grant submission work, and grant funding work to where the norm becomes community-led research, right? How can we support community-led orgs who are already the ones doing the hard lifting and on the ground and engaging with community daily to actually lead and say, this is the research question, this is the intervention that we want to assess and to test. And they get to lead and yes, collaborate with academics and others that could fill in pieces, but community-led research is what we should aspire to, even though we're not there. And so I'm really happy that we've been piloting this program here at CHARM for community pilot awards, and Jasmine McKenzie and the McKenzie Project was a recipient for one of those ongoing pilots, but we need to move a lot more further into community-led.
Thanks y'all so much. This might be our last question, depending on how much time we have. But an anonymous question asks, being from Florida myself, I've seen how our governor's anti-DEI stance has impacted our diverse communities. How can we push back against this stance and educate about the importance of funding diverse communities projects? That no specific person listed for that. We know Ms. McKenzie's in Florida if you have any thoughts, but open to any speakers who want to share. And if no one has thoughts, can always go to the next question.
Okay, if I was trying to unmute, it's giving me a hard time. So for me, I see what's going on. I hear what's going on, and I think what makes the work I do so powerful is that I'm someone who come from seeing girls do black markets for many years. I come from being someone who have been around other people who have engaged in survival sex work to make sure that they bills and rent is paid. So I think the lived experience of what I have lived has taught me how to navigate around everything that the governor has thrown at me. When he said we don't want trans people in sports, I created the trans game. When he said about the gender, whole thing about the gender, they didn't think about the gender marker. We found a solution. We created the passport project. When they said, oh, trans kids are not going to get healthcare or whatever case may be, guess what we did? We connected with a pilot company, and they flew children out who was clients of ours, and we was able to fly them to New York and Chicago to get the healthcare that they needed. When he said that he was gonna take away sex ed, guess what I did? I created a support group, and we do monthly events where we teach younger individuals about sex education. So every time we do something, I find a way to work around it. And I always use this as an example. Black people, Black trans people have been behind the Black market for so long. So when that whole situation happened about, oh, we're going to take this away from the children, the Black community, they was not bothered. They didn't care because the first thing they said is, oh, we're going to go back to Black market. But see, not everybody experienced that, and that's not the way we want people to go to engage in Black market. But we knew as Black people, if that was our only way of survival, that's what we was going to do. And we was okay with him saying, oh, we're going to take this law away. Guess what, Ron? We don't care about you. We're still going to make it happen. So I think a part of that is we have to come together in more spaces. We have to be realistically real with people, and with each other, and find real solutions. There are solutions to the problems, but I think oftentimes people, they panic because they don't know. They go into uproar because they don't know. And I'm telling y'all, every time this man drops something, I'm dropping something right back at him. And if I had the opportunity to sit and talk to him, he might tell me to get up out of his office, because everything he throw at me, I'm gonna have an answer and a solution to fix his problem with every single thing that he throw at me. And I really, really honestly know that it comes from my lived experience of how to survive in the state of Florida as a person who is breathing while Black and trans.
Thank you so much, Ms. McKenzie, for sharing that. We had a question. We've only got a few more minutes left. And we had one question from the chat concerning how many trans and queer people are affected by long COVID, but we may not have time to talk about that. I'm not sure if that's anyone's expertise here. But I do think we have to wrap up soon. But if anyone has any final thoughts for folks, or just what areas of your research that you hope people will take away from this, or any closing words for us?
I'd like to say that there's a lot at stake at this election. And one of the candidates served as president of this country for 4 years, and it was not good for LGBTQ people. So I think people have a choice. They can choose hope, they can choose economic opportunity, economies, and I think that there are some very clear differences in policy priorities and agendas of the two candidates. And I really hope, as Jose suggested, people are registering to vote, getting out to vote, supporting other people in voting. I think this election is critical.
Thank you so much, Dr. Conran. And we're just about at time, so I'll go ahead and wrap up our discussion. Just thank you so much, everyone, for joining us today, and to all of our esteemed experts and panelists. Really was such a wonderful time learning from y'all and learning from our audience questions. Thanks, everyone, for being so engaged today.
I'll jump in then to say thank you again, to echo. First of all, I want to say thank you to Orion for expertly facilitating. Thank you to the audience, and to the panelists and to the audience. I thought this was a really fantastic session that really inhabits the series that we try to create, which is A Vote for Health, to surface the issues that are so important in this country right now, that a lot of them will be influenced by the upcoming election. So I want to thank everybody for engaging in that, and for everything that you do in your day-to-day work to advance understanding, science, scholarship, and activism in these areas. Everybody, thank you. Have a wonderful afternoon, wonderful evening, or a good day wherever you are. Take good care, everybody.